Thank you so much for the kind introduction. So, I'm going to be dealing with a very, very practical topic because all of us know that obesity is increasing exponentially. And as physicians, we all need to give some kind of obesity care to our patients, even if it isn't full time. At least some part of our practice has to be devoted to obesity care in a scientific manner. Otherwise, you all know that patients just go anywhere at all, get any kind of advice which is non scientific, and land up in trouble. So, we need to provide the solutions to our patients. So, how best we can do this is the crux of the matter. And the other thing is that I started obesity practice in India, exclusive obesity practice, about 22 to 24 years ago, when not many doctors were foraying into that, for the simple reason that there were no drugs. There was nothing to offer to the patient other than just diet and exercise, and hence it was not a very lucrative proposition. But I just started it at that time alongside my diabetes center. So I'm going to share some of my experiences and what I do in my obesity clinic. Having said that, if somebody has a busy diabetes or a physician practice, what I would suggest is that for the time being, or just to begin, one can devote an entire day of the week to obesity practice. That would be a nice way to start it, like say a Thursday or a Friday, when the entire day is devoted to obesity. That is a nice way to start, and then increase it as and when you feel the need. So I'm going to be dealing with the practical aspects of how you need to go about it, how you need to design your clinic, and what are the algorithms that you can use. So this is the overview. I'll talk about the space, the team, the infrastructure and protocol development, and how you can actually lead by example. The very first challenge when you start an obesity center is, if you call it a weight loss clinic, you're in for trouble, because you are then competing with all the people who do unscientific weight loss in the market. So, most people and many healthcare professionals as well, they equate obesity treatment to weight loss. And that is why we made a poster for my center which says, we treat obesity, not just weight. So this is the crux of the matter that will differentiate you from all the players in the market which say that we treat obesity and not just weight. So weight is a byproduct or a ancillary thing that you are doing, but you are actually treating obesity, the disease. How do you organize an office? It's a little different way that you need to organize it. It's not your typical physician office. There have to be some changes in that. So I've just put in a picture here of our reception area. Now, this is a multi-specialty hospital, but this is the general reception area. Then coming to the waiting area, what you can do in the waiting area is you can put posters there which are very, very educative, because while they're waiting to meet you, a lot of material can be put out there and patients will very keenly read it. You can put something about muscle, you can put something about protein, you can put something about preservation of muscle, what is diet, what is exercise, and things like that. And you can have a nutrition corner where the most scientific data is put up in a nice way. You can provide health focused magazines, have a brochure rack providing, the substitution choices for bad food. So you have this instead of this, all the things that you see on your Instagram reels and Facebook shorts. What you can do is you can put them here, and people will be more receptive because they have come there to lose weight. The other thing is you need to have open arm chairs. I'm going to show you, or you can have benches like this. This was my earlier clinic, which is now we made a bigger one. So now we have chairs like this, which do not have armrests, and where the patient can sit comfortably. And because there is diabetes and obesity as well, I would say that have wider chairs for everyone. Let's not discriminate. So that is the reason that we put things up like this at our center. Now coming to what do you need? Honestly, a simple obesity clinic is not investment intensive. What you need is a tape. You can do the non-elastic measurement tapes, and if feasible, a full body mirror, so you can take the measurements for the waist circumference nicely by looking into the mirror and having it straight up. Then this is good to have. I have this machine. I've taken it from my center. The body composition analysis. This is the one that I've been using. It's a very good guide to tell you about the body composition. If everyone cannot have a DEXA, so this is for me this is the next best, and for clinical practice this works well enough, and it kind of tells you where you're going. It shows to the patient this is the fat you're losing, this is the protein or lean mass that you have, and things like that. So this helps you to kind of uh, convince the patient that this is what you need and this is where you need to go, why you're giving carbs, why you're giving proteins. All of these can be explained a little on the body composition. This is another thing that we have, and that is the hand grip, dynamometer for the grip strength. Because all of you know that sarcopenia goes hand in hand with obesity. So while we put patients on a weight loss program, we want them to also see what is their sarcopenic status, because it shouldn't get worse once when the patient starts to lose weight. So that is one thing we have. This is another thing that we provide once or twice a month. I don't own the machine, but you can always get it on rent, because you all know that fatty liver today and MASLD is part and parcel of obesity. You got to treat it along with that. And if you remember my first slide, which says I treat obesity and not just weight, then you are going to be treating this as well. So that is very, very important. So this is something else that you can have. Then I told you about the accommodations. You may want to have larger sized gowns, the furniture, everything. You have to make the patient feel welcome. And not so it becomes non-judgmental also. If you have these kind of facilities, these are small little things, but they should be available. Then comes the protocol development. Frankly speaking, you can all develop your own protocols. You can use the guidelines from various places and make your own protocols to suit the kind of staff that you have. It all depends upon how much of a qualified staff you have, what they can do. Can they take the entire history for you? Can they themselves order investigations based on what the patient says? So, based on that, you need to have your protocols. So it all depends upon who you have. Of course, you can train your people, but until then, your protocols have to be tailored to your center, to what one can possibly do. So this is a good guide. This is an algorithm that we developed and published in JAPI in October 2023. Dr. Shashank Shah, also who is here, was a co-author on this, and this is a entire algorithm, step 1, 2, 3, 4, right from anthropometric evaluation to clinical evaluation using lab tests, risk stratification and management. And for the stratification, we have simply adopted the Edmonton obesity staging system right into it. We didn't want to reinvent the wheel, because it works really well, and you can just incorporate into this for the assessment part. And then we have suggested an algorithm even for the management part. So you can develop your protocols the way you want them based on something like this. This is what we follow. Then what is important is the team approach. You can never do this alone. So as I said, if you want to do this once a week, say on a Thursday or a Friday, you try to make sure that this team is available on that day, so that everything is taken care of comprehensively. You are not too stressed out. You can do the important counseling part, and the remaining things which are not really very medical, the cost, what you're going to use, that can be done by somebody else. So everybody's time is valued. So one important thing is your front office staff. They have to be trained very well. They have to speak the same language that you do. They have to have a good rapport with the patients, and they always do. So reinforcement of messages, positivity can actually go through them, because they open up to the front office staff and receptionists more and more. Then you need trained paramedical staff, coordinators, 1, 2, as the case may be. And these are the people who will obtain the measurements. You have to train them properly for that. Ask questions about lifestyle, diet. So a nutritionist also can be there and provide some kind of counseling even at that level. And this should all be documented in the patient's records. Dietitian is the backbone of this entire enterprise, because diet counseling is there throughout the trajectory, whether it is only diet and exercise, Whether you're giving pharmacotherapy, whether a person is on bariatric surgery, you need nutrition counseling across the board. And that is the reason that you need to have a good nutritionist, a compassionate one, a non judgmental one who will give no nonsense scientific advice. Because there are too many people giving non-scientific advice. You have to differentiate yourself, and you need to have on call a psychologist, a bariatric surgeon, a social worker. We have all of these on call, and my on call bariatric surgeon is sitting right here who comes in whenever I need him. And this is the last part of my talk, and this is leading by example. So if you and your team have the conviction that all these things work and you actually walk the talk, then only you will be able to convince your patients. So you need to make sure that everybody in your team is on board when it comes to activity, when it comes to counseling patients. They themselves need to know. Now, if I have to tell my patients, cut sugar completely, I have to have done it sometime in my life at least to know how it feels and whether it's really possible. So, leading by example is a big thing which I feel many physicians don't do. And if you do this, then yes, you are very likely to have that note of conviction while you're counseling your patients if you're doing it. So, that's very, very important. The habits of the staff should reflect a healthy environment. You can't be having, croissants and sandwiches and bread, too much of that in your canteen, and here you are advocating to them to have a low carb diet, something like that. So you've got to be really, really careful. You must encourage healthy snacks and lunch for staff. And if there are vending machines, not many people have this, then here also you need to take care to have the healthy stuff and a personal commitment towards maintaining a healthy lifestyle to staff and patients. So you can have some, walk with your doctor, you can start a challenge, you can have a marathon with your patients and, actually show them, do some public events where you have a lot of activity. This gets you publicity as well as the fact that you are doing it yourself. Now that is extremely important. That's why I say leading by example is very, very important. And these are pictures of me cycling across somewhere that we put on social media to tell them, yes, I am indeed leading by example. So this is something that needs to be there as well. So this is in a nutshell, if you ask me, on how to go about starting an obesity clinic and starting this service. Like I said, you can start small and then gradually add more and more things. But this is how your team needs to be organized, need based, and the protocols also need to be properly designed. You can also use technology to enhance weight loss interventions. It can start simply from WhatsApp messages to your patients, to having an app of your own, to your patients actually sending photographs of foods and you analyzing them, telling them. There are n number of ways you can be very creative about it. And you can decide how far you want to go that route. So it doesn't mean everyone has to do everything, but you can adopt some of the things and you can do this. So there are cost effective options. You can do all of this behavioral therapy and all of that. Telephone based counseling. If someone can't come in every week for a weigh in, or if someone is staying far off, you can also do this long distance and still be successful. And many devices are there, like I said, self-monitoring apps that are very useful. You can do all of these things. So to put it in a nutshell, before I have just 1 minute more. So to put it in a nutshell, you need to actually publicize that you are treating obesity and not just weight loss. Secondly, you need to have the infrastructure, which, as I said earlier, is not really very, very investment intensive. You can have very, very minimal kind of things. Third thing, you need an excellent team who is well coached in counseling, well coached in being very cordial with the patients. Remember, they are already a depressed lot, many of them. So you need to really empathize with them very, very well. And lastly, you have to lead by example. And finally, you can also use technology for achieving a lot of what you want to convey to the patient. Thank you very much. And